All right. Well, welcome everyone. Thank you for joining us. My name is Jesse Stife. I'm the president of the Reading League Florida, and we are super excited to bring you tonight's session, Foundational Reading Skills in a Multi-Tiered System of Support. We have just a couple of short announcements here before we get into the content of tonight's excellent webinar. I want to encourage everyone to keep up with the Reading League Florida on our various websites. The main way that we communicate with folks is through social media, and you can find us on Facebook at the Reading League Florida or at TRLFL. We're always putting out and sharing kind of high quality resources that are directly applicable for teachers and other stakeholders. So go ahead and follow us on Facebook if you're so inclined. You can also find us at fl.thereadingleague.org or on Twitter at the Reading League Florida. And while you're on our pages, I'll encourage everyone to consider making a donation or joining us as a member. Your membership helps us kind of keep the lights on and keep the free, high quality professional development coming. We are an all-volunteer 501c3 organization, and so this is only a labor of love that everyone at the Reading League Florida does for free, and every penny from donations and membership goes right back into the organization to help us keep putting out the free events like this. You know, our aim is to keep all of our content free and publicly available, since we never want money to be a barrier for high-quality professional development. And so for tonight's webinar, we've opened up the Q&A, and we welcome our live participants here to ask questions during the presentation. Our presenters will be taking some questions at the end. Please remember to just use the Q&A, though, to ask questions and not to make general comments, since it makes it a little difficult for us to work through all those entries. All right, and lastly, it's my pleasure to kick it on over to Drs. Valentina Contesse, Holly Lane, and Matt Burns of the University of Florida Literacy Institute. Thank you all very much for your time and your generosity and your work supporting educators across the country, and please take it away.
All right, thank you, Jesse, and hello, everyone. On behalf of the University of Florida Literacy Institute faculty, we're very excited to be here and to get us kicked off with the first of our series of 3 webinars. As you can see, we have webinars coming up in November and December, and we will be giving you a little bit of a teaser, a little preview toward the end of tonight for the ones that are coming up. But for now, what we're going to get started with is just our kind of big picture overview of multi-tiered systems of support and some of the things that need to be a part of those. So our focus is going to be on foundational reading skills. We will be talking about this in terms of how your foundational reading skills instruction can fit into a multi-tiered system. So if you are not familiar with the University of Florida Literacy Institute, or UFLI, our work really is at the intersection of teacher development and reader development. We support children in their development of reading skills by supporting their teachers. So to get us started, I thought we would take a quick look at how we're doing as a country in the development of reading proficiency. And so to do that, we are going to get us started by looking at some results from our nation's report card, the National Assessment of Educational Progress. So to get us started, I thought it would be helpful to think about what the National Center on Education Statistics, how they define the NAEP achievement levels. So the highest level that a student can score on the NAEP is called the advanced level, and this is superior performance. So that one is pretty clear. The next ones are not as clear, and I've heard a lot of misinformation related to the other levels. So I thought it would be helpful to clear these up. NAEP defines the proficient level as representing solid academic performance, and that students reaching this level have demonstrated competency over challenging subject matter. And this is the idea that they are able to achieve at their grade level. Below proficient, we have the basic level. And basic, according to NAEP, denotes partial mastery of the knowledge and skills that are fundamental for proficient work at a given grade level. So only partial mastery of those skills at grade level work indicates that this is where we can delineate where we want kids to be. We want them to be proficient. We want them to have more than partial mastery of grade level skills. So this line is kind of the basic level that we want kids to get past. We want them to get past basic into the proficient level. Unfortunately, this doesn't happen enough. So if we look at the 2022 NAEP, which is our most recent administration of this assessment, we see that only 33% of fourth grade students performed at or above the proficient level. So only 33%, 1/3 of our students are reading at the proficient or advanced levels. Everyone else is partial mastery at best. 21% of our Hispanic students are performing at or above the proficient level. So when we start to look at subgroups, it gets worse than the national average. Only 19% of the students who are eligible for our national school lunch program are performing at or above the proficient level. Only 17% of Black students, only 11% of students with disabilities, and only 10% of English learners are performing at or above the proficient level. So clearly there's a problem here, a problem that we need to be addressing. If we look back at those levels and we agree that we want kids to be at the proficient level or above, and we know that only 33% are reaching proficiency or above, we look at below that line at the basic level and we see only 33% are reaching the basic level. So I'm a reading person, not a math person, but I'm pretty sure that's not all of the students. So we have 2/3 of our students represented. The other third is below this. There is not a specific NAEP level. It's just typically referred to as below basic. It doesn't have its own definition. It just means that these children are not even reaching partial mastery of grade level work. So that's our largest group. So 1/3 of our students are not even reaching partial mastery. Again, a pretty big problem that we need to be addressing as a nation. We can agree that literacy is essential for academic success. That part's pretty obvious. You can't do well in other subject areas if you're not doing well in reading. But it's also essential for social and economic success. There's lots of research that tells us that children who read more proficiently tend to do other things well, like graduate from high school, but also enter the workforce and have better income. That children with higher literacy rates tend to be more successful in their careers. So the takeaway here is we need to make sure, if we want to be equitable, we want to make sure that all students have access to successful lives, successful careers. It really is an issue of equity and social justice. Without achieving in reading, children are limited in what their life options are. And because of this, we consider literacy a basic human right. We want to ensure that children are reading, that they're reading early, and they're reading well. So this all brings us all to the big picture of the science of reading. And we just wanted to be clear, because we have people from all over joining us tonight, on what is the science of reading. We want to just make sure that what we're talking about is clear for everyone. So in a nutshell, we can define the science of reading as the accumulated body of evidence about reading generated from research in a variety of fields. So this idea is that we have studied how children learn how to read, what the reading process entails, and how reading can be taught successfully. And there is a very, very large body of evidence that tells us what works and what doesn't, and how reading develops and how it doesn't. And we need to be paying attention to that, because a lot of what's happening in schools in the name of reading instruction is not working. And that's evidenced by the NAEP scores that I just shared. So when we talk about the science of reading and this body of research, unfortunately, most teachers are familiar, if they're familiar with research at all, they're familiar with research from the field of education. And that's only one little part of the science of reading. So education research is really about pedagogy or instructional methods, instructional materials. What do teachers know and what can they do? And looking at student outcomes. So education research gives us some pretty useful information, but it's really only one piece of the puzzle. A lot of the research on reading comes from psychology. This includes cognitive psychology and developmental psychology, school psychology. But psychology research has given us so much information, mostly about thinking and learning. So when we're talking about psychology research, we're talking about research on memory and attention and perception and problem solving. And all of those things are important elements of learning how to read. But again, that's not the whole picture. Another important piece of the puzzle is the linguistics research. Linguistics really is the study of language structures, including semantics, syntax, morphology, phonology, phonetics, lots of different elements of language that contribute to proficient reading. And we need to be aware of the research in linguistics. The last piece of this puzzle, and this really isn't everything that goes into the science of reading, but it's the bulk of it. The last body of research is neuroscience. And neuroscience is the study of the human brain. And this includes the study of its structure, its function, the function of different locations in the brain, patterns of activation in the brain, and just general brain development. And the neuroscience research on reading is probably the farthest removed, well, it is the farthest removed from the classroom. So it's not like we can just give all of our kids MRIs and understand their reading better. It's just really not how it works. But the research on the brain and how it processes print and how it processes language, those things are really helpful for us as we learn about reading instruction. And there has been research showing that different kinds of instruction actually changes brain function and even changes to some degree brain structure. So although neuroscience is farther removed from the classroom, it can be useful to know something about what's going on in the brain as reading is occurring. So this body of research is what we consider constitutes the science of reading. And so what we're talking about through these webinars is evidence-based practices for instruction and for intervention and for assessment that will guide us. And again, when we're talking about the science of reading, it's not about a program or a particular element of reading. It's what goes into reading and what evidence do we have for how people learn how to read and how they can best be taught to read. So we're going to be sharing some resources. One of them is a webinar recording that goes a little bit more into depth of what I just covered related to what is the science of reading. That is one resource. There's another resource called Science or Snake Oil and How to Tell the Difference. Just helping viewers to understand what effective research is and how do we tell when something really is based on evidence versus just has the term science of reading stamped on it. So we'll be sharing these resources and a lot of other resources as well. So when we're talking about this body of evidence, we're talking about a huge body of evidence, and a lot of that research was reviewed by the National Reading Panel. This was 23 years ago, it was in the year 2000. that this was published, and the research spanned back many years before that. But they reviewed thousands upon thousands of studies about how children learn how to read. Now, the National Reading Panel was about early reading instruction and early reading development. And it didn't look at every study out there, but it looked at an enormous body of research and gave us some really good information. One of the things that's important to understand, though, about the National Reading Panel report is how it was characterized after it came out wasn't always really what was in the report. And what I mean by that, one of the things I mean by that, is that the National Reading Panel findings are often characterized as the 5 pillars of reading. And these 5 elements are absolutely essential components of reading, but the National Reading Panel didn't really ever characterize them this way as these 5 things. And I actually find it pretty problematic. Now, before the National Reading Panel report came out, we could have asked 100 teachers, what are the key elements of reading? And we would have gotten 100 different answers. And now if we ask teachers, what are the key elements of reading? Probably 99 of them will say these 5 things, which is a great improvement. It's really focusing us in on important things. But the problem with this characterization of reading is that these things are not 5 separate things. And one of the problems with it is that it's just saying, here's comprehension over here as one of these 5 things, when in reality, comprehension is the whole reason that we read. All of the other things contribute to comprehension. And some of these other things are related. For example, phonemic awareness helps develop decoding, or phonics, makes it phonics instruction work. And phonics instruction leads us to fluency. So these things are closely connected. They're not separate pillars, and we need to quit thinking of them that way, because I think that that leads to some really poor instructional decisions. And we'll be getting into that as we get into our other webinars. One of the things that we have done at UF is to think about the elements of reading a little bit differently. It's not as simple and clean and clear as this, but we use a framework where we center reading comprehension as the purpose for reading. And then we look at other elements as influencing reading comprehension. So fluency, language, knowledge, and metacognition are all things that contribute to reading comprehension. You see phonemic awareness and decoding as components of fluent reading. And vocabulary is one of the components of language, but those are not the only things. There are other things. There's life experiences and content knowledge that are just as important. All of these are important influences to reading comprehension, and each influence has different components. So although it isn't as simple and clean and easy to rattle off as the Fab Five, we feel like this is a framework that can be useful for understanding the components of reading at a deeper level, not just the surface level. So this is one of the things that we'll be coming back to and referring to and thinking about where all of these things fit together. So you've probably heard about the simple view of reading, but just in case, I'm going to do a super quick overview of this, because this really sets up a lot of the things that we'll be talking about later. So the simple view of reading was proposed by Goff and Tumner, and it is something that has had a lot of research, and it's actually stood up to quite a bit of scrutiny over time. The simple view of reading can be summed up in one sentence, that reading comprehension is the product of decoding and linguistic comprehension. The simple view of reading is stated simply. It does not suggest that reading is a simple process. It's actually quite complex, but this helps us understand it more simply. So when we're talking about reading comprehension being the product of decoding and linguistic comprehension, that is the key word in that sentence. And that is because we can think about this as a mathematical formula. So we have decoding times linguistic comprehension equals reading comprehension. So product is a key word because we want to think about it as this multiplication problem. The idea behind this is that anything times 0 equals 0. So if both decoding and linguistic comprehension are missing, then of course reading comprehension will be missing. If both of them are intact, it doesn't guarantee that we'll have strong reading comprehension, but it makes it much more likely. If either one of these is missing, though, reading comprehension is missing. So you can have strong decoding skills and weak linguistic comprehension, and that means that you'll have weak reading comprehension. So an example of this is I can decode in Spanish or Finnish pretty well because those are pretty transparent orthographies. It means that the letter sound correspondences are pretty simple and reliable. So I can decode a sentence in Finnish, but I don't speak Finnish. So I'm not going to understand what that is. So if I have strong decoding skills, but 0 linguistic comprehension skills, I'm going to have 0 reading comprehension. And the opposite is also true. If I've got strong language, spoken language skills, but no decoding skills, this might be, for example, a child who hasn't been taught how to read words yet, or it might be an older student who has dyslexia. Someone who can't decode but has strong linguistic comprehension skills, they're still not going to have reading comprehension because you've got to have both. So if either one is weak, reading comprehension will be weak. And if both are weak, reading comprehension will be even weaker. So we've got to have strong decoding and strong language comprehension skills in order to get to strong reading comprehension. If we see a problem with reading comprehension, the approach that I see very often in schools is a poor performance on a reading comprehension test. Let's teach this child reading comprehension strategies, that's what they're missing. And that's almost never the right solution to that problem. Instead, what we need to be doing is looking at the other side of the equation to see where the difficulties are. Is it a problem with decoding? Is it a problem with linguistic comprehension? Or is it a problem in both areas? And that's how we determine how to solve the problem that we see in that reading comprehension test. So just to clarify, though, for our purposes of this particular webinar series, we're going to be focusing on the decoding side of the equation. Now, that in no way suggests that decoding is more important than linguistic comprehension, as I've just explained, I hope, pretty clearly. These are equally important areas of reading. We need to be good at both of them. But in a 3-part webinar series, we're only going to be really addressing in any depth the decoding side of the equation. So this also is represented in what you probably have also seen is this rope metaphor from Hollis Scarborough. The idea that we have linguistic comprehension, as she refers to it as language comprehension, and the decoding side of the equation here is represented as word recognition. She represents these as separate strands, and that combined, they form these 2 main areas. Language comprehension and word recognition. Over time, the language comprehension strands of the rope become increasingly strategic. And over time, the word recognition strands become increasingly automatic. And as they are fully developed and woven tightly together, that's how we arrive at skilled reading. So again, we're going to be focusing in on this word recognition side of the rope as well. So to get us going in this area, we're going to talk a little bit about some of the research on how children learn to read words. And we'll be coming back to this a bit, but we're going to be focused on Aries phases of word recognition development. So to begin with, Aries phases, she refers to as phases very deliberately to distinguish them from stages. So the way that she talks about this is that a phase Phases overlap with each other, where a stage has a beginning and an end. And in word recognition development, there is a lot of overlap, and you'll see evidence of a child being in more than one phase at a time at several times during their development. So in most of Mary's work, she talks about 4 phases, but in a couple of papers, she talks about a 5th phase. So I'm going to give you a quick overview of all 5 of the phases of word recognition development. So the first phase that she talks about is the pre-alphabetic phase. And this is before children start to learn about letters and sounds and how they work together. So in the pre-alphabetic phase, this is when a child sees a logo that often will be something that they're familiar with because they've had experiences with it before. And when they see it, they'll respond. I see the McDonald's logo and I say, "Oh, mommy, can I have a Happy Meal?" And mommy says, "Oh my goodness, my child can read." In reality, we know that's not what's going on there. The child is not reading the word McDonald's. They're seeing the golden arches and thinking French fries. So the idea here is that a logo is, or a picture of some kind, is representing meaning to that child, and they're making that connection, but their connection has nothing to do with letters and sounds. So in the pre-alphabetic phase, children do tend to rely on irrelevant visual cues to figure things out. And that will also be something that we'll be coming back to. In the next phase, this is the partial alphabetic phase. This is when kids start to notice letters, but they may not notice the whole word, right? So kids usually will start by focusing on the initial letter in a word. They'll move to the final letter, and then the last is attention to the internal letters. So, for example, a child might have seen at some point a word that began with the letter P, and in that instance, that word was puppy. But the next time the child sees a word that begins with the letter P, and the time after that, and the time after that, the child thinks, "Oh, that's puppy. That worked once, it must work each time." But they don't really know how to attend to the rest of the word to figure out what's going on. So the partial alphabetic phase is really just looking at pieces of the word to get to some pronunciation, and there's usually a whole lot of guessing going on still. The next phase is called the full alphabetic phase. And in the full alphabetic phase, children start to notice all of the letters in the word. This is when they're doing letter by letter decoding, where they can look at k, a, t, and get to the word cat. And so at this phase, this is what we would consider truly reading words or truly decoding words. So the full alphabetic phase is the goal of most initial phonics instruction. We want to get kids to start to attend to every letter in the word so that they can get to the word itself. But we don't want them to stop there. We don't want them to always be looking at every letter individually. We want them to start to notice patterns and start to process patterns. And what Ari calls this is the consolidated alphabetic phase. In the consolidated alphabetic phase, children start to look at chunks within words. So for a word like splash, they might notice the SPL pattern and the ASH pattern, and they will process in chunks like that to get to the word splash. So this is a little different from how a lot of instruction goes. So sometimes we'll see chunks like this, maybe word family work. So let's practice the at family. That's often introduced very early in instruction before kids learn letter by letter decoding. And that's a problem because we want to see kids get to the point of consolidating after they've learned letter by letter decoding. That's how skilled readers develop. But if their instruction emphasizes word families before they're proficient at letter by letter decoding, then it's really addressing their development in an inaccurate sequence. So we want to be careful about that. Now, after the consolidated alphabetic phase, this is the 5th phase that is not in all of the writings that Ari has done on these phases, but I think it's worth talking about as well. And that is the automatic phase. And that's what probably everybody watching this webinar is at. You're probably all at the automatic phase. This is what truly proficient adult level proficiency reading would be. And so what I'm going to do is give you some text on the screen, and I want you to read along with the text as it appears. And I want you to see if you can keep up with it. Okay, so are you ready? Here goes. Did you finish by the time the end of that last sentence appeared on the screen? If so, congratulations, you're at the automatic phase of word recognition development. So that's what we want for all of our students eventually. And a lot of kids, by the end of their elementary school career, they have reached this phase. Some kids, it may take longer, and some kids may never get there. We want all students to be able to get to that automatic phase. So we will share this table. This is just the 4 phases that Ari most often talks about. A brief description of what is happening in each of these phases, and then what instruction should look like. And an important element of this is that instruction in each phase should always be designed to push children into the next phase. When a child is in a particular phase, we don't want our instruction to match those skills. We want them to be pushing them into the next phase. We always want to get kids to continue their development. So how does this all fit into a multi-tiered system with support? So we're going to be talking tonight about some of the things that go into effective instruction and intervention. So you are probably familiar, but just to be sure, with this idea of a multi-tiered system. All students in a multi-tiered system should get core instruction, high quality tier 1. This is something that should be available and provided to all children. But even with really, really good core instruction, there's always going to be some kids who need something more. And so for those children, we provide tier 2 supplemental instruction, but this should be a fairly small percentage of our students. And an even smaller percentage of our students should end up needing intensive intervention. So the idea here is that with high quality core, high quality tier 1, you should not have very many children in intervention at all. Unfortunately, what we often will see is essentially an upside down triangle, right? Where we have a lot of kids needing intervention, and of the kids needing intervention, a lot of them need intensive intervention. And this is a big problem. We need to make sure that what we're doing at the tier 1 level is preventing this from happening. If you're providing really good, high quality tier 1 instruction, then that means that around 80 to 85% of your students' needs should be met. If that's not happening, if you have a larger percentage of kids not meeting instructional goals with your tier 1, then that means there's a problem with your tier 1. One of my favorite sayings related to this comes from my friend Michelle Elia, who says you can't intervene your way out of a tier 1 problem. I think that's a really important thing for us to keep in mind, that if tier 1 is not meeting kids' needs, it doesn't matter how much intervention that you provide, you're never going to get where you want to go. You've got to fix tier 1. So let's think about what that means. To get high quality tier 1, we have to make sure that we're providing very strong instruction. And when we're talking about foundational skills, what effective instruction includes are some key components. So the first key component that I want to talk about is that instruction is explicit. So when I say explicit instruction, I mean that it's clear and direct, it's unambiguous. You know exactly what I mean. You know exactly what I want you to learn. I'm frequently checking to make sure you're understanding what I'm teaching you, you're actively involved, and you're experiencing a lot of success. Those are key elements of explicit instruction. So I'm going to demonstrate a little bit about what, to show you what effective explicit instruction looks like. Okay, and so this is from UFLI Foundations, and this is teacher language that's provided. And with the teacher language, we also have visual supports. So these are the slides that the children would be seeing while I'm instructing. So this is the introduction to the consonant digraph SH, representing the phoneme sh. So a consonant digraph is when two consonants come together to make one sound. You've already learned about a consonant digraph. We've talked about CK. When C and K are together at the end of a word, they make one sound. So that's one of the elements of explicit instruction, is that I'm connecting it to your prior knowledge. The two consonants S and H have their own sounds, S and H. But when these consonants come together in words, they make one new sound, sh, like at the beginning of the word sheep. The consonant digraph SH can come at the beginning of a word, such as ship and shop. The consonant digraph SH can also come at the end of a word, such as fish and wish. Okay, so at this point, I've connected it to prior knowledge. I've explained what this concept is, that a consonant digraph is when two letters come together, and I've explained what the two letters separately mean and what happens when they come together. I've given also examples of where this grapheme will appear in a one-syllable word. So these are all parts of an initial introduction to a grapheme phoneme correspondence. So I can then go a little bit deeper and talk about the articulatory gesture, or what your mouth is doing as you're producing the phoneme for sh. Okay, so to make the sh sound, put your teeth together and round your lips like this. Shh. Pull your tongue back toward the back of your mouth. Be sure your voice is off, because this is a quiet sound. The sh sound is a continuous sound that can be stretched out. Watch me. Shh. You try. Okay, and at this point, I would then connect this phoneme that we've been talking about with the grapheme, and say this is the grapheme that represents the sound sh. The next part of this, I would practice letter formation. If my students still needed to spend some time practicing what an S looks like or what an H looks like, we would practice over and over forming each of these letters. I would then go on to practice reading words. I would do some modeling. I do, ed, and then we do. I will do some guided practice where we will read some words together. After that, we'll spend some time spelling some words. So I will model spelling a word, and then we'll spell some words together. So all of this is explicit instruction. We can identify some key components to explicit instruction. There's a strong explanation, there's demonstration, there's guided practice that we're doing together, but I'm also going to give you some independent practice, some opportunity to practice this on your own. We're also going to do some additional practice over time to ensure maintenance of this new concept and generalization to different contexts. So this is explicit instruction. Okay, so one of the key features of effective instruction in foundational skills is that it is explicit. Another key feature is that it is systematic. So when I'm talking about systematic, I'm talking about it being logically sequenced, building on things you already know, and proceeding in manageable steps, not taking big leaps. So the best example that I can come up with for systematic instruction is a blueprint. An architect's blueprint is what guides the building of anything. And a builder would never show up on a vacant lot just with a bunch of boards and start nailing them together. That's not how it goes, right? A builder has a plan, and the plan proceeds in a specific sequence. There are certain things that have to be done in a certain order. You've got to lay a strong foundation before you can put on walls. So you've got to have walls before you can put on a roof. Now, it may not matter some of the details. So you might be able to put in this door before that window or vice versa. But there are certain things that have to happen in a certain order. So when we're talking about reading instruction, our blueprint is our scope and sequence. This gives us the sequence of skills in a specific order. Now, could some of those be moved around a little bit? Sure. But you've got to have the simple concepts down before you can move on to the complex concepts. It's a good idea to have the more common grapheme phoneme correspondences before you have the more complex or less common ones. So having a strong scope and sequence that follows these key features is a really important part of effective foundational skill instruction. So effective instruction is explicit and it's systematic. There are other key features, though. Probably the most important of all is having ample opportunities to respond. So we can think of an opportunity to respond as anything that the teacher says or does that will elicit a response from students. So a request, a direction, or a question that gets the students to do something, to say something, to respond. Okay, so the idea here is practice, practice, practice. We want to make sure students are getting as much practice as we can in the time that we have with them. And this is because we know that although some students might learn a word or learn a new skill with just a few exposures, other kids need lots of exposures. And it's not going to hurt the kids who don't need lots of exposures to have them, but it will absolutely harm the kids who need them if they don't get them. So we want to provide as many opportunities to respond as we possibly can during each lesson. So some examples of what opportunities to respond might look like or sound like in a foundational skills instruction lesson. Repeat this sound. What sound does this letter spell? Read this word, spell this word. Let's count the sounds in this word. All of these are asking students to do something or to say something. And all of these are opportunities for students to practice. And we want to get in as much practice as we possibly can. We know that the more practice we provide, the more interactive our instruction is. And when we have truly interactive instruction, we see increases in attention, on-task behavior, and just overall learning. And we also see decreases in behavior problems. So truly interactive instruction is beneficial in many ways, but in particular, it helps kids learn better. One of the other features of instruction that's really important is how you space out the instruction and how you connect it with other concepts. So when we talk about practice, there's been a lot of research on different types of practice. So there is blocked practice or massed practice, where the practice is all together for one skill. So I introduce a skill, I practice, practice, practice until I master that skill. And then I move on to a new skill. Practice, practice, practice it until I've mastered it, and then move on to a new skill. Another way of practicing is interleave practice, which is distributed over time. And I introduce a skill, I practice it some, probably not to mastery, before I'm introduced to another skill, which I also practice some, again, probably not to mastery, before I'm introduced to another skill. But I keep coming back to those same skills over time until I get to the point where I've mastered them. But what's important to know is that interleave practice and distributed practice tends to lead to much better long-term retention than blocked or massed practice does. So although it seems like kids are mastering those skills, they don't tend to retain them over time when we do blocked practice. So a really good example of this is how a lot of classrooms treat spelling. So you give kids a list of words at the beginning of the week, they practice, practice, practice all week, they get tested on Friday, they get 100%, and we move on to a new list. But we know deep down, we know that if we come back 5, 6, 7 weeks later and assess that same list, those kids who got 100% will now get 50% or 40%. They're not going to get 100%, most children. So that blocked practice doesn't lead to long-term retention as well as interleave practice does. So it's not just that we get a lot of practice, it's the type of practice that we get that also matters. Yikes, what's happening? Okay, sorry. Okay, so when we're talking about opportunities to respond, we can think that practice makes perfect. But if we think that, we would be wrong. Practice does not make perfect. Practice makes permanent. So we need to make sure that the practice that kids are getting is accurate practice, that they're practicing things the right way. So what that means is we need to monitor practice and we need to provide feedback to our students based on whether their practice is correct or incorrect. So one way we can do this is by, if we see correct practice happening, then we provide behavior-specific praise. So when we're talking about behavior-specific praise, we're talking about any kind of verbal statement that is positive and communicates to students exactly what they did well, what was correct about their response. So this might be something behaviorally focused, like nice job following directions the first time, or it might be more specific to the skill that we're working on. Great job saying the ooh and cool. Awesome work blending those letter sounds. Good thinking to try a new vowel sound there. So it's never just nice job, awesome work, good thinking. It's great job doing this thing. Awesome work doing this thing. So we're always explaining exactly what was done well. This is much more likely to result in a repeat of that behavior that was the correct response. So we want to make sure that when we see correct responses, we're acknowledging them and we're acknowledging them specifically. If a response is incorrect, we need to provide corrective feedback for students. So corrective feedback is any kind of specific, brief, immediate correction of a response that is not correct. The key element of effective corrective feedback, though, is that it also elicits the correct response. It never has to include anything about, oops, nope, you got that wrong, or nope, that's not right. You don't even have to say that. You just need to model the correct response and elicit the correct response from your students. So for example, if I showed my students the word ship and we're sounding it out, we blend this word together, and I hear one of my students, instead of saying ship, I hear them say chip, as if it had a CH, right? So what I would do at that point is I would point to the SH and say, this is the grapheme SH. SH spells shh. What does SH spell? And the whole class would reply, shh. And then I'd say, sound this word out with me again. Ship. What word? Ship. And hopefully that will correct the problem. If it doesn't, we will go back and do it again. But the idea is I want to make sure that I'm not letting incorrect associations just sit there without being addressed, because what that will lead to is a permanent response. I want to make sure that practice is making perfect, because the practice itself is correct. So when I'm providing corrective feedback, it should always basically follow the same correction procedure. And I do, we do, you do. I'm going to model the correct response. I'm going to guide all students in saying the correct response, and then ask them for a choral response without me saying it. And so I can do that with individual grapheme phoneme correspondences. If I have I'm doing a visual drill and I have this letter up and I hear a student say that, A is I instead of a, I'm going to say A spells ah. Say it with me. A spells ah, your turn. And then my students hopefully would then say A spells ah. So I want to just make sure that I'm eliciting the correct response from them. I can also do this when we're sounding out a whole word. So if I get a different word here, I will point to each letter and say that word is flash, flash. say it with me and have the students do it along with me, and then give them an opportunity to do it without my support. So effective instruction is explicit, it's systematic, there's ample opportunities to respond, we have behavior-specific praise or corrective feedback based on whether the responses are correct. So all of those things are also true of intervention. It's explicit, systematic, with lots of opportunities to respond and appropriate feedback. But effective intervention also has another element, and that is that it is intensive. So when we're talking about it being intensive, we're talking about instruction with smaller groups or even one-on-one. We're having more opportunities for targeted practice, and we're spending more time, longer duration. All of these are what makes instruction more intensive, which is what is the key ingredient to making it intervention. So when we're talking about increasing intensity in that tier 1 instruction, we're going to always provide that explicit instruction right off the bat. I do, we do, you do. But because we know how important practice is, we're going to throw in a little bit more. And because we're in the South, we're going to make one of those at least a y'all do. So I do it is I'm going to model it for you. We do it is guided practice with everybody doing it together. Y'all do it means I'm going to put you in pairs to practice or in small groups to practice. And then you do it as you show me that you can do it all by yourself. In tier 2, we just have more of all of that. And in tier 3, we have even more. So what distinguishes intervention, the tier 2 and tier 3 work from tier 1, is that there's more opportunities to practice. Your intervention should not be qualitatively different from your instruction. It should be quantitatively different. What I mean by that is we have practices in quite a few schools where we have completely different programs for tier 1, tier 2, and tier 3. That makes zero sense. You think about it, a different program for phonics, let's say, in tier 1, tier 2, tier 3 means you have 3 different scope and sequences, 3 different ways of explaining concepts, 3 different ways of practicing skills. And these are for the most vulnerable, already most confused children. And we're just making it harder for them when we do this. So instead of having a different program at each tier, if you have a strong tier 1 program, you should be using that same program in tier 2 and tier 3 to provide kids with more opportunities to respond. So the other element of intensive instruction is that you're providing it by the most skilled person. The person that's got the best skills for providing good instruction should be doing intervention. And I say this because often I'll go into schools and see the volunteer grandma over here in the corner with little Johnny, who is the most struggling reader. Volunteer grandma doesn't have those skills to help little Johnny, and we need to make sure that the person who is capable of helping him is who's working with him. Volunteer grandma can help with the kids who keep the kids busy, who are able to do these things already, give them other things to do, while the teacher who's got those intervention skills is working with the struggling students. So effective intervention is all the things effective instruction is, except it's also more intensive. So the research is pretty clear that effective intervention is explicit, that it's systematic, and that it's intensive. Pretty much all the experts would agree on those 3 features of effective reading intervention. There's one other feature of intervention that is a little bit more controversial, and that is that some people will tell you that intervention also needs to be multisensory. And this is where we tend to not agree quite as much. And that's because we can't necessarily agree on a definition of what multisensory is. So just to be really clear what we're talking about here with multisensory instruction, this is the idea behind it is we're coordinating the simultaneous use of multiple sensory pathways. And the idea behind it is that it should enhance memory and learning of written language. So typically what we're talking about is coordinating visual, auditory, kinesthetic, and tactile instruction. So incorporating all of these senses in our instruction. This is often referred to as VAKT. The idea behind it, again, being that connections are consistently reinforced between symbols, sounds, and movements. So the problem with this is that there's not a whole lot of research to support its use for all kinds of multisensory instruction. For some kinds, there's a little bit more robust research base than for others. So to help me keep this sorted out, I've kind of, in my head, organized it into two categories of multisensory. So the first category is macro level. This is just my terminology that I use to help me keep this straight. Macro level multisensory techniques are the ones that are using large movements of large muscles. So usually the arms and fingers, so clapping things out, counting out the sounds, writing, and so on. So some of the examples of macro level multisensory techniques would include saying a sound while looking at and tracing a letter, skywriting a word, tracing letters in sand or shaving cream, using manipulative letters. These are generally considered the kind of the larger movements, the larger muscles. Micro level multisensory techniques are the ones that use smaller movements and smaller muscles, the muscles of the vocal tract. So this includes things like saying a sound while watching the mouth in a mirror and attending to what your lips and your tongue are doing. So that would be a micro level method. It could also be distinguishing among sounds based on their mouth movements. So if I showed you these different mouth shapes, these pictures, you could probably determine which consonant sound is being produced by each of these, or at least you could narrow it down. So the first mouth on the left, we know that there are only 3 sounds that are made with our lips together like that. We have the sound, we have the p sound, and we have the b sound. The sounds associated with M, P, and B are the only sounds that we really make with our lips together like that. The mouth in the middle, that could be a lot of different sounds, but it still narrows it down to just specific ones. So where our tongue goes up behind our top teeth would be sounds like O or T or D or N. In those cases, our tongue is touching that ridge behind our top teeth. The mouth on the right, in that case, where our top teeth are on our bottom lip, could really only be a F or a V sound, the sounds associated with the letters F and V. So even if you aren't familiar with teaching kids about the articulatory gestures or their mouth movements, you're probably familiar with what our mouths are doing when we're producing sounds enough to come up with some of those. Vowel sounds are a little bit trickier. They're a little bit harder to distinguish, but the same basic things apply. With vowel sounds, we're not obstructing the airflow like we are with consonant sounds. But in the case of our vowel sounds, what's happening is either the lips shapes are different. So we can have a smiley one, like the one on the left, an wide open one, like the one in the middle, or a tight rounded one. And the only other differences is where our tongue is. So our tongue might be higher or lower in the mouth, or it might be more forward or further back in the mouth while we're producing these sounds. And that the shape of our lips, along with the position of our tongue, is what distinguishes our different vowels. So when we're talking about multisensory instruction, those micro level techniques have a bit more research behind them. There are programs that use these instruction and articulatory gestures, using the pictures, using other instruction to help kids attend to what their mouths are doing. And the idea behind that is that that is accessing the phoneme. So when we're talking about phonemes, most educators think of a phoneme as the smallest unit of sound in spoken language. That's accurate, but it's an incomplete definition because a phoneme is also the physical act used to produce the sound. And so to be phonemically aware, you need to be aware of both what you're hearing and what your mouth is doing. And micro level multisensory techniques help kids access that information about what their mouth is doing. So instead of thinking about it as doing things with our hands, we want to really be thinking about multisensory instruction, attending to what is happening in our mouth. So when we're talking about intervention, we can talk about multisensory as being a piece of it, but we need to be careful. The larger macro level movements really don't have much research behind them. So we need to be thoughtful about what multisensory actually means. So to wrap up this first part of our session tonight, I just want to review the idea that in a multi-tiered system of support, all children need to be receiving strong tier 1 instruction. Effective tier 1 needs to be meeting the needs of at least 80% of students. And a small percentage of students should be able to go beyond that for tier 2 and tier 3. Ultimately, the key idea here is you can't intervene your way out of a tier 1 problem. So I'm going to turn it over to Valentina Contesse, who will give you a little preview of the second webinar, and then we'll hear from Matt Burns, who will give you a preview of the third webinar.
Thanks, Holly. That was such a great overview. And now we will talk a little bit about the upcoming webinars. So in our next webinar, we will discuss the what, how, and why of teaching foundational reading skills within this multi-tiered systems of support. So explicit and systematic instruction in foundational reading skills should support the development of key elements that lead to proficient reading. So we'll focus in this topic next time we meet. As Holly discussed, the instruction that we should be providing students should include targeted opportunities to respond and high quality feedback, including both behavior-specific praise and corrective feedback. This visual that we'll look at of the road to fluent reading begins with the development of both spoken language and written language. So children, of course, need to learn about sounds in our language and about letters. But when these two merge together, we refer to those connections as grapheme phoning correspondences, or GPC, since that's a really long term that doesn't fit here on our visual. So there's always a one-to-one correspondence between phonemes and graphemes, like we see with this example in the word sheep. But what makes learning to read and teaching reading really challenging is that most graphemes are made up of more than one letter, like we see here in sheep. So in the grapheme SH for the sh phoneme, we see the letters S and H. In the vowel team EE, we see the two letters E and E, and an easy one with the grapheme P, just the letter P. This means that we need to be providing students, again, that explicit and systematic instruction in grapheme phoning correspondences to support their foundational reading skills. Once students have learned just a few grapheme phoning correspondences, it's really important that we provide instruction and practice with reading and spelling words. So as soon as students learn the grapheme phoning correspondences, for example, that A spells at and T spells t, they could read the word at. They could also practice spelling that word. Then when they add a new grapheme phoning correspondence, for example, M spells they could read the word mat. So it's really important that we focus on moving students from learning grapheme phoning correspondences to the application of those grapheme phoning correspondences in words. And then when students learn just a few words, both regular words and irregular words, they can begin to read text. It's really important that our instruction includes text so that students understand the purpose of learning grapheme phoning correspondences and reading and writing words. As we're moving through this road to fluent reading, we need to focus our instruction on accuracy, students being able to do these skills accurately, but also automaticity, which is going to support, again, their fluent reading and lead to proficient reading. Being able to perform any task with automaticity means that we can do it with minimal conscious effort, which is our goal with our instruction. This is going to ultimately support students being able to comprehend text. So less fluent readers spend a lot of their cognitive load or working memory sounding out or decoding words, which limits how much they can support their comprehension of the text they're reading. So our goal in developing foundational reading skills through explicit and systematic instruction is to help students become more fluent readers that can devote more of their cognitive load or working memory to comprehending text. And we're so excited to be spending the whole next series or next webinar in the series on this topic. So now I will hand it to Matt, who will introduce us to the third webinar in the series.
I'm going to do my best. Oh, hold on just a second.
Okay.
There we go.
See if we can go back up.
Handing over remote control is always tricky.
I have it, but I don't know how to go back a slide. That's okay. I don't need to. Be fine. All right, great. So I'm excited to have this conversation, and this is, I love hearing this information about teaching kids to sound out words and teaching phonics and the basic code aspects of reading to the point of automaticity. And Teresa asked the question, where do you begin? Well, I'm not sure I'm interpreting your question correctly, Teresa, but my answer to that's always going to be assessment. Assessment tells us where to begin, and assessment tells us when we're done, basically, if we're ever done. And when we talk about assessment, we really want to talk about a few purposes. First of all, screening. And I'll give credit to Holly. These are not my cool pictures. These are very well done and very descriptive. Screening is just like this gold digger here, sifting to see what's in there, sifting to see, what if you sift through enough sand, will you find a nugget of gold? Well, screening is looking at all the kids and see which ones need that additional support. And then once we've identified a kid as needing additional support, we collect additional data to figure out what's going on. We get additional diagnostic data to figure out what types of supports the kid needs, et cetera, and where we should target our instruction or intervention. And then, of course, we have to progress monitor. That's telling us, just like you go to a doctor once a year and says, yep, you're doing well, your blood pressure and temperature, et cetera, are in the normal range. Well, we progress monitor by collecting data frequently to see if you're in that average range, normal range, proficient range, or if you're at least getting closer to it. And then, of course, most people think assessment in schools, they think of this. They think of outcome measurement, which is the state test, right? All kids have to be good at it. We need kids to get there. But I'm a reading interventionist, and I, of course, am passionate about and use assessment quite a bit. I've never once gone to a teacher and said, okay, let's figure out what's going on with this kid. Let me see his state test scores. Those don't usually help. It's those other three. Are the kids doing well? What type of help do the kids need? And are they making progress? Those are three sources of data I really focus on when we talk about intervention and instruction. So screening, we use the data to see, hey, you know what? A lot of the kids are doing really well. In fact, some of the kids are doing better than well, right? So a large number of kids, or hopefully a large number of kids, as was mentioned in the beginning, are doing pretty well. But then we've got some kids who just need a little bit of support and some kids who need some intensive support. So screening will answer that question. Which of these colors do the kids' skills fall into? And then, of course, we move on to collecting diagnostic data, and we absolutely need to get data on the kids who need the most intensive support. Those are the kids who really have to dive in and see what's going on and collect quite a bit of diagnostic data. But even I would argue the kids in that tier 2, yellow, whatever you want to call it, just needing a little additional support. Even them, I think we need to get some good diagnostic data to see our starting point at the very least. And of course, everyone needs progress monitoring and outcome assessments. We should be assessing the kids, at least every kid 3 times a year. And of course, the outcome measures are once a year. Now, there are lots of there are measures to do all these. In Florida, we've got STAR. But if you're not in Florida, you've got A reading, early reading, NWA map, Dibbles, Acadians. Those are all fine screeners. If you're then collecting diagnostic data, then you have to assess the individual measures, the individual skills, down to the level of, can they, what types of phonemes and graphemes do they know, down to that very level. And then, of course, we monitor progress. It's really tough to beat curriculum-based measurement to monitor student progress. Ames, Web, Acadian, Dibbles, FastBridge, CBMR, those types of things are really designed for the purposes of monitoring progress. Now, real quickly, I'll make this one point. I made this point once before, and I'll make it in more detail in a couple of weeks or several weeks from now. This is a study we did with the Contesse benchmark assessment system. And we looked at there's three assessments here. The criterion was the MAP, the Measures of Academic Progress, NWA. It's a good measure. It's a good screener. Then we have Ames Web, or Reading Fluency, and the Contesse benchmark assessment system. Now, the Contesse benchmark assessment system on page 3 says you can use these data to screen kids' reading skills. So we thought that was interesting. There was no data anywhere else in that entire manual to support that claim. So we thought we'd study it. So real briefly, I'll focus on the F&P. If we look at the Ames Web, look at Ames Web, among the 646 kids who did well on MAP, 501 of them did well on Ames Web, which is 78%. Pretty good. Think of it like a grade. That's a C+, right? And then we look at the 22 kids who didn't do well on the MAP, 276 of them didn't do well on Ames Web, which is 86%. Much better. That's a solid B+. And I'm okay with a couple kids like that trade-off, identifying kids really well who are struggling, and maybe identifying a kid who needs help that didn't really need it. That I'm okay with. Overall correct classification, 80%. Good, B-. But look at the F&P. Among the 556 kids who did well on the MAP, 367 did well on the F&P, which is 66%. That's a D, not great. But among the 290 kids who didn't do well on the MAP, only 90 of them didn't do well in the F&P, which is 31%. Probably, in fact, I'm pretty sure the lowest I've ever seen. Overall correct classification of 54%, which means you can buy this test, train all your teachers, take 20 or 30 minutes per kid, or just give each teacher a quarter. Flip it, and they'll get it right just as often. The F&P was not designed to be a screener. It was designed to be a tool that drives instruction. I think it does that very poorly too, but we'll talk more about that later. But it is not designed to be a screener. We have to go back and make sure that the measures we use match the purpose for which we are using them. And that's what we'll spend more time on in a few weeks, identifying measures for each of these particular purposes, and then using those data to figure out what kids need. And Holly, I think I'll turn it back over to you to conclude.
Yeah, so thank you, Matt, and thank you, Valentina, for giving us a little preview of the upcoming webinars. We have the dates and times on the screen, and hopefully you will be back to spend some more time with us. We will also stop now, and I will stop sharing the screen so that we can answer any questions that you may have. If you have any questions, you can put them in the Q&A or put them in the chat, and we will come back to that. But I also want to direct you to our website that has a lot of information about a lot of the topics we've been talking about. And also you can follow us on social media and get a lot of information and connect with us that way as well. But let me stop sharing and see if there are any questions that we can help you with.
Thank you, everyone. As fantastic as always. We do have a couple of questions here in the Q&A. There's a live person asked if the recording will be sent. Yes, the recording will be sent to everyone who registers. There's a question about a starting place, which I think dovetails with the other question that's here in the Q&A. Teresa asks about a starting place for instruction. So that you understand you have a group of children who require tier 2 or tier 3 intervention in foundational reading skills. what is the best way, or what would you suggest as a place to begin the work? And I think Dr. Burns had mentioned assessment. Maybe you want to talk about where you'd start with assessment and go from there.
Do you want to, Holly or Val, do you want to respond to that and I'll chime in?
So sure, yes. So the idea here with, obviously, as Matt mentioned, we want to start with assessment to determine where we need to start instructionally. But generally, the idea here is if you have multiple approaches within a school, the idea is to narrow that down so that we are not confusing kids who are struggling with different approaches. The best way is for a school to agree on one approach school-wide, so that if children are in multiple classes or over time as they move through the grade levels, that they're getting the same kind of instruction. And if they are going to one teacher for core instruction and another teacher for intervention, that what they're learning isn't confusing, that they're not going back and forth with different programs, different scope and sequences, and so on. So ideally getting the instruction to be something that is going to be effective school-wide is going to be critical. And then for identifying who needs help, using the screening assessments, as Matt mentioned, and then making sure that we're following kids' progress to make sure that if they maybe didn't need intervention at first, but now they do, or they needed intervention for a while, but now they don't, you know when to begin and end.
And I've heard all three of you in various forums talk about this sort of concept of drill down assessment, where with terms of where you start. So we have a student who does not do well on a screener, and then your diagnostic process is sort of a way of further narrowing down of skills until you get to that most fundamental piece where we need to start a student building up from there. I think maybe we had a couple of questions in the chat that were wanting you to touch on that. Can you speak a little bit more about that?
Yeah, we'll spend quite a bit of time on that in the I think it's just the December webinar. But yeah, we'll show you a framework where you in essence start with word reading and work your way down till you get down to whatever basic level you need to get to with each individual kid. And the diagnostic assessments to do that, there are many of them that are free. Basically any measure that addresses single skills can really be used for a diagnostic assessment. Something like even a nonsense word fluency, which as a reading person has always kind of bugged me because it's not really reading, but it's not supposed to be reading. It's can the kids sound out words? And it does that really, really well. And there are plenty free ones of those. There are free spelling inventories that can really help you isolate decoding skills. Spelling is one of the best measures of decoding. I know it's encoding, but spelling can really help you get a good indication of holes in their phonetic development quite nicely. Dibble's reading fluency measures. There's lots of free ones out there that are available.
And I'll add that, especially for those students receiving tier 2 or tier 3 intervention, it's important that we continue to progress monitor, but do even more frequent progress monitoring to be able to make decisions about how to adjust intervention as needed based on their progress or lack of progress based on the instruction and intervention they're receiving. So assessment continues to be important even after we identify where to begin and what to target.
Yeah, the Reading League Florida and UFLI, of course, do not have a financial relationship with any diagnostic measures. One of the ones that often gets mentioned in this conversation is the core phonics survey. That is from a book, Core Assessing Reading Multiple Measures. It is not free. You might find free versions of it online, but that is using it would be not in the copyright. Would be violating the copyright. So please purchase the book. It's excellent. There's a partner book called the Core Teaching Reading Source Book. Should be part of everyone's professional library. Fantastic one. There is a free one that I've used in my practice from a place called Really Great Reading. They have a beginning and advanced decoding surveys. Beginning decoding surveys will look at various phonics skills and single syllable words, and the advanced decoding will look at multi-syllable words, and it's excellent, and it's free. And they had the folks at Really Great Reading have a number of other diagnostic assessments as well.
Can I add there, Jesse, that you mentioned the core assessment book. The core phonics survey is only a tiny part of that book. There are many, many other assessments in the book, and it really is a great tool. So I use all of the different assessments in there, not just the phonics survey. The phonics survey is the one that's best known, but there's lots of other good stuff there.
Absolutely.
I also like the quick phonics screener is another good one that's really helpful.
Perfect. If anyone doesn't have anything else to add, there's another question in here that I would love to hear everyone's thoughts on. There's a question around school districts moving towards using a single program. So there are districts out there in Florida and across the country that are likely using multiple tier 1 programs, and are kind of adding additional resources into their tier 1. It is likely muddying the waters when it comes to providing interventions for children at tier 2 and tier 3. I'm wondering if you'll have thoughts on that or want to expand a little bit.
I'll let somebody else go.
Well, we're all going to say the same thing, I think. I would argue there is no one program that does everything we need it to do. And so I'm okay with there being multiple programs as long as they're complementary, as long as they're, each one adds a component to the overall, reading proficiency, then that's not necessarily a bad thing. Where we see a problem is when we use 2 different phonics programs, right? Or that type of thing. But if one really focuses on phonics and one focuses more on a language aspect of reading, I think that's actually not a bad place to be. I don't think we'll ever have, I don't know of a program right now that does everything we need it to do.
Agreed.
No one tool. Absolutely. Let's see here. Other questions.
Jesse, I'm not able to answer in the chat to everyone, but a couple of people have asked for the name of the book. Again, the core assessment book is called Assessing Reading Multiple Measures. And if you just put in core assessment, you'll probably come up with that in search for it.
There's another question here around your recommendations for tier 2 instruction when tier 1 instruction is UFLI. You kind of addressed that, but maybe you want to talk about that more explicitly, because I know a lot of folks on the call are probably using UFLI as tier 1.
Yeah, well, that would be a good example of when having the same phonics program for tier 1 and tier 2 and even tier 3 makes a lot of sense. That the distinguishing feature between the tiers should be how many opportunities to respond. So children who are getting it in tier 1 and also getting it in tier 2 or even tier 3 are getting more opportunities to practice the skills. When you have an older student who may not be getting it in tier 1, that's okay to be still providing an intervention because they're probably not getting some other phonics instruction in, say, 4th grade, but they may be lacking some of the skills that UFLI covers in kindergarten, 1st and 2nd grade. So providing the intervention based on your diagnostic assessment of which skills they have and which skills they still need work on makes sense then. But if your kids are getting some phonics instruction in their core instruction, then using the same program. And it doesn't have to be UFLI. There's other good programs out there, but don't mix and match. It drives me a little bit nuts when I hear, oh, we're using this for tier 1 and this for tier 2 and this for tier 3. That's just not a good choice, especially for something like phonics that follows a scope and sequence.
Absolutely. There's another question here. I know our audience tends to be primarily elementary teachers, especially for something like this. But there's a great question: what intervention programs and assessments can you recommend for Tier 2 and Tier 3 interventions for students in grades 6 through 8, or even in high school?
Well, as far as the assessments, some of the same assessments of those are the same kinds of skills that they're struggling with. So we often will see reading comprehension be the thing that alerts us to problems when we're talking about older kids. We see that they struggle on the state test. And so then when we are looking a little bit deeper, we need to assess both the decoding side of that equation and the linguistic comprehension side. If we assess if we start our assessment on the decoding side with an oral reading fluency, that's can they read the words on the page, and they do fine, that means the problem is in language skills. So you need to focus your intervention that direction. If they're struggling in oral reading fluency, then you're going to dig deeper. And we're going to hear a lot more about this in the session in December, but you just want to keep digging deeper as you go. So if it's text level automaticity is a problem, well, how about word level automaticity? If that's a problem, how about decoding accuracy? If that's a problem, how about phonemic awareness? So you're just drilling down until you find the point where you need to intervene. The program choice should then be based on where the problem is. There's not going to be one program. We use UFLI with all ages of students who need help with the specific skills. If they don't need help in those specific skills that are addressed in our scope and sequence, it's not the right program for them. You might, if they might need decoding help, but it might be more multisyllabic word reading. There are programs like Word Connections is a great program that addresses multisyllabic words. Morpheme Magic is good for focusing on morpheme level skills. So it's really digging deep and using your assessments to tell you, well, what are the problems and then what to address.
Right.
One quick word of caution for that. I did a study a couple years ago. It's not published yet. We looked at high school kids, 9th and 10th grade, and a quarter of the kids, so about half the kids who were struggling, couldn't decode to a basic level. Like for them, basic decoding was the correct intervention.
Absolutely. Well, all right. It is 6:30. We are at the end of our time. We're 6:30 on the dot. Amazing timing, folks. Very good. Thank you again. Thank you so much for your time, for the generosity with your knowledge. This was fantastic. The praises coming through in the chat. So we're going to end here, and we'll remind everyone our next webinar is coming up on November 15th. If you haven't registered, if you registered for this one but not that one, you can go back to where you found it, either Twitter or Facebook or wherever it was, and go ahead and register for it. They will remain free. Yeah, thank you so much. We appreciate your time, and enjoy your dinner, and we'll see you next time.
Well, thank you to the Reading League of Florida for hosting this, and thank you all for coming. We appreciate your involvement.
All right, appreciate it.